Hiya. Today is a little bit of a rant against one of the things that I see all the time in my practice, and it drives me a little bit nuts. So, if you have knee pain or lower back pain, those are the two main ones, and you're overweight, you may have heard from the doctor that until you lose the weight, you'll never be able to get rid of the pain of your lower back pain or your knee pain. Those are the most common ones. Sometimes you also get like ankle, hip, things like that. Now, why do I hate this? In today's video, I'm going to go into detail about why this is one of my pet hates and what you can actually do that doesn't involve losing weight. Hi, I'm Catherine. I'm the founder and principal therapist at Leighton Sports Massage, a sport and remedial massage therapy clinic in London. In this channel, I have self-care tips and information about how your body works because I want to help you live your life and enjoy your favorite activities pain-free or as close to it as possible. So first of all, I want to be really clear. I really respect doctors and other healthcare professionals, and I don't think that we should go around just disregarding what they're saying all the time. But this is one specific thing that I see that then gets people stuck into a loop because they have like this knee or lower back pain. And so they want to be exercising and they want to be getting healthy. They want to be losing weight, but because of the pain, they can't. It hurts too much to go for a walk or go for a run, or, their knee or their lower back. So they don't do exercises. They don't do things that are going to help increase their metabolism because of the pain. But then when they try and go get help for the pain, they're told, well, you're not going to be able to get rid of this pain until you lose weight. And obviously not all doctors or healthcare practitioners say this. It's just something I've come across enough that I wanted to address in this channel so that if you're one of those people, you know that you're not necessarily doomed to have this pain as long as you're overweight. Now, the other thing that I want to be clear about is I'm not talking about like morbidly obese people. I'm not talking about people who have so much extra weight that they can't stand up or they really can't move, because obviously that is a huge strain on the body, and that's not really the kind of overweight that I'm talking about. I'm talking about maybe in the range of 50 to 100 pounds overweight, where and obviously it depends on your starting point. If you're 6'2", 100 pounds overweight is going to look like one thing, and if you're 5'2", 100 pounds overweight may count as morbidly obese. I mean, I'm not sure. I'd have to see the person. The point is, I'm talking about people who are kind of in the range where you would definitely say that they're maybe over the ideal weight that they should be, but they're not to the point where it's really, really bad, if that makes sense. And so what I've seen with this group of people is that they develop a knee pain, they develop a lower back pain, and they go to their doctor, and their doctor's like, well, you just have to lose weight. There's nothing I can do for you until you lose weight. And we all know that losing weight is a struggle. There's hormone imbalances, stress makes it harder to lose weight. People can have medical conditions that make it difficult. It's a very complicated thing. Especially for women of a certain age, women who've had children, and it's also a very personal subject as well. So there can be a lot of emotion around it, and people can try to lose weight and be unsuccessful and get really depressed about it. So then to add the idea that they're going to have to be in constant pain, to me seems totally unnecessary, because here's the thing. Our bodies are amazingly resilient. And it is possible in many, many, many cases where you have knee or lower back pain that's linked to being overweight, that we can get rid of it and keep it away without having to lose weight. Yes, obviously losing weight is going to help. If you lose weight, there's less of you to carry around. It's less strain on your muscles. I'm not going to say that it doesn't matter, but it's not you're not doomed to have this pain just because you're overweight. So what we've done with clients before is, we release the muscles that are overworking and too tight, and we get them to start strengthening the muscles with really gentle, safe exercises for them to support that. And we've gotten rid of knee pain, and we've gotten rid of lower back pain, and we've gotten people working, because as long as you're working on your muscles can really support your body in good movement. And then they're able to start exercising and taking better care of themselves. And so why is this one of my pet hates? Why is this something that I'm like, about? Well, the reason is that if you tell someone that they're not going to be able to get rid of their pain until they lose weight, they will believe you and they won't even try. Like, of course there are cases where we're not going to be able to fix their pain or help their pain. Of course there are. We can't fix everything. There can be underlying causes. There can be underlying problems. Even in cases where we can't completely get rid of the pain, there are often things we can do to decrease it. But if you, as a person who is maybe already a little bit self-conscious about your weight, and you're told, oh yeah, there's nothing you can do about it until you lose weight, you're not going to go out to a physio or a massage therapist or a remedial therapist who's going to be able to understand your body and help you get better. You're not going to try to do stretches. You're not going to try to do like rehab exercises. You're not going to seek out that information because you've basically been told, well, you're overweight. So you lose weight. You're not going to get rid of the pain until you do. So if you are someone who is a bit overweight and you've been told that you can't get rid of your pain until you lose the weight and you're really struggling, please look into other alternatives. I can't say that definitely you can have it go away because it really depends person to person. It really depends on the situation. But I really want you to have the opportunity to investigate and see what your options are. Because honestly, if you have knee pain and you release your IT band and you release your quads and you activate your glutes, you will be in such a better position for your knee. And if you have lower back pain and you release your hip flexors and you activate your abdominals, you will really be in such a better position. But you do have to do it gently and you do have to do it safely. So if you are someone who has been told that you couldn't get rid of a pain unless you lost weight, like maybe you're one of our clients that's watching, please leave a comment below and let people know that that was your experience, even if you're not one of our clients. But if you had that experience and you got rid of the pain without losing a ton of weight, share in the comments so that other people can see it and be encouraged. And if you're someone who's in that situation where you're feeling really discouraged because you've been told that you can't get better until you lose the weight, let us know what it is and I'll try to point you in the direction of some resources. Obviously, I can't give you medical advice because I can't see you in person and it's just going to be for information purposes. But sometimes when you get the information that helps you and you can start going in that direction, you may find that you get some help. Because I really don't want you to, like, if you don't need to be living with that pain every day, I would really love it if we could get rid of it for you. And of course, if you're local to London and we're open for face-to-face appointments, please come in and see us if you'd like us to help you with this, or maybe a video session would work for you. You can get in touch, let us know. You can go to our website and book in a 10-minute call. So I would love to know if you've been in that situation or if this speaks to you in any way. If you know anyone who's in this situation, please share this video with them so they know that they could have options. Again, can't say for sure, can't say 100%, but it's happened enough times that I can say it's definitely possible for a large proportion of people who are in this situation. Also, I want to reemphasize, always listen to your doctor. I'm definitely not saying don't listen to doctors. This is just like one little area where sometimes not quite the best advice is given, in my opinion. But definitely listen to your doctor. Don't go in there and be like, I'm not going to listen to you because I saw some video on YouTube that said blah, blah, blah. Please don't do that. So if you like this video, please smash the like button. My son wanted me to say smash the like button, like all the YouTubers do that he watches. And the notifications bell so you're notified, and subscribe so you don't miss any future videos. I love all the comments. If anybody leaves a comment, I love it. Let me know what you think if you have any questions. And thank you so much for watching. I'll see you in the next video. Bye.